Hello, my name is Donna Edgell, and I'm one of the nurses here at Olean General Hospital. Today I want to talk about a cesarean birth. Should that be a necessity or an elective, or I wasn't planning on this? To give you an idea of what a cesarean birth is, what else entailed with it, so that you are prepared in case a cesarean delivery is the safest, best way for you to have your child. A cesarean birth is, by definition, a birth of a baby by surgery. The doctor makes an incision or cut in the abdomen and uterus and then removes the baby. It's usually performed when a vaginal delivery is not safe. A cesarean can either be scheduled or it can be emergency. If it's an emergency, it needs to occur within 30 to 60 minutes of the decision that a cesarean needs to be made. What would cause me to have a cesarean? Or a C-section as we call it. There are like 4 different things that we call that could be reasons for a cesarean. The powers, the passenger, the passageway, or general problems. The powers include how much your uterus isn't powerful enough to get those contractions to push that baby out. Regardless of what we do, what medications we use, it's not getting the baby to come. The passenger is the baby itself and the positions that the baby is in the pelvis. Passageway would be the pelvis itself. The pelvis isn't big enough to accommodate the size of the baby. Problems include different things such as diabetes, the baby's position, we already went over some of that, or baby's heart rate's going down, baby needs to come now. Those are some of the minor problems. Okay? So everybody asks, what are the risks? Well, a C-section is a major operation, and the risks from the surgery itself come with regular surgery and anesthesia. The National Center for Health Statistics estimates that 1 in 3 babies in the United States are delivered by a cesarean section. Well, what are the risks for the babies? Well, the anesthesia may cause the baby to be inactive or sluggish first off. There could be breathing problems. Even if they are full term, babies born by C-section are more likely to have breathing problems than babies who are born by a vaginal delivery. That's typically because they don't get that squeeze that happens with the vaginal delivery with a cesarean delivery. Risk for mom? Well, mom has an increased risk for bleeding, which may require a blood transfusion. Infection, because we're doing an incision, even though we take precautions for those. Reactions to medications. That can happen with everything. Don't know until we try, okay? Including the drugs used for anesthesia. Injury to the bladder, bowel, blood clots in the legs, pelvic organs, lungs, and you have an increased risk of pneumonia, simply from being in bed and not being up and moving around afterwards. Okay. If you're going to have a cesarean delivery, some of the things that we need to prepare you for, okay? You're going to have an IV of fluid to help keep your blood pressure where it needs to be so it doesn't drop with anesthesia. We usually remove that about 24 hours after delivery. Okay. We're going to insert a Foley catheter. That's going to keep the bladder out of your way so that the doc can get to your uterus without any problems. We're going to do a little shave clip prep. Okay. What we have is we have a little electric shaver, and we're going to shave the hair, the pubic hair, out of the way. First off, so that the incision is nice and clean, and second of all, when they put that bandage over there, they don't have that ripping off like a wax job. And not a good idea. Okay. We're going to give you some antacids, simply because you're laying on your back and all that fluid's going to go up with that baby being there. So we're going to give you some antacids to help prevent the nausea. And we're going to ask you not to eat or anything by mouth, just because we want that stomach empty so that we can prevent some of that nausea and vomiting that can occur. Our C-section room is located on our 4th floor, so if you need a cesarean, you do not necessarily need to leave the floor to deliver your baby. Anesthesia that they usually use 2 types. If you've been in labor for a while and cesarean is a safer way to deliver the baby, they will use your epidural if you had one. If you didn't, then they will do what they call a spinal anesthesia, and you won't feel anything from basically your nipples down to your toes. Okay? We're going to clean your skin off with a skin prep antiseptic. We're going to use sterile drapes, which means the covering over your body. We're going to get you all covered so that when the doc does the incision, that we're in a sterile field. And one support person can come into the OR with you. They are welcome to take their cameras and take pictures, still pictures of the baby after the baby's been born, nothing of the delivery itself. Okay? We're going to ask you to change into scrubs or our blue clothes as they are now. And we're going to have you wear a hat, mask, shoe covers, so that you can maintain that sterile field and reduce the possibility of infection to mom. The delivery of the baby itself takes 5 to 10, maybe 15 minutes. It's the setting up. As I say, setting up takes longer than doing. We want to make sure everything is good and set up before we actually do that. After the baby comes, baby's delivered, it's given to the nurses to take over to the warmer. Often the providers will show the mom the baby so they can see their baby that was just born. Then they will take the baby over to the warmer. We'll get it all together. You'll hear your baby crying. We'll put the ID bands on the baby. We'll do the footprints, all that stuff. And then we will bring the baby back to you. You're welcome to do skin to skin at that point in time. It's difficult to do the breastfeeding at that point in time in the C-section room, but we will give you that opportunity to bond with your baby, see your baby, as long as baby's doing well and stabilized before the baby goes to the nursery. When baby goes to the nursery, the support person will go with us when we go to the nursery. Okay? They can use different things to close the skin. They can use staples, dissolving staples, sutures, glue, any combination of all those. Depending upon your anatomy and what the provider uses routinely to keep you safe. Baby is in that warmer for that 5 to 15 minute period after delivery. Moms and dads, like I said, you get to touch and see your baby. And then the support person goes with the baby to the nursery. At this point in time, we are not permitting the parents in the nursery for the weight and measurement part of that, but you can take the baby to the nursery in the crib at that point in time, okay? Differences in recovery between a cesarean delivery and a vaginal delivery. A cesarean delivery is going to take a little longer. You had surgery. You have an incision. It's going to take it a little longer to heal than with a vaginal delivery. Your hospital stay is an average of 3 days. A 24-hour discharge with a cesarean is not usually acceptable because you're not ready. You still haven't walked a lot. You may not have had to go to the bathroom yet. That catheter that we put in whenever you were in surgery, we take out in about 18 to 24 hours. Okay. We're going to make sure that you are out of bed in 6 hours. We're going to have you move your feet back and forth and up and down in bed as able. Also, we're going to have some compression devices on your lower legs to help aid in that circulation while you're in bed. Once you're up and moving around, those are no longer necessary, but initially they will be on there. They will also be on there during surgery too, again, because you're laying down. We want to prevent things from happening as well, and those help us to prevent blood clots. We're going to have you cough and deep breathe while you're in bed. We're going to have you hold your belly, hold your incision tight, and then cough your toes through your nose. Okay? Is not coughing your toes through your nose. That's coughing your toes through your nose. That's what we're going to have you do. Keep those lungs open, the secretions from creating pneumonia, and that sort of thing while you're laying in bed. Your incision can be stingy, itchy, burning. We're going to give you pain medicine. Often what they use for anesthesia lasts for 18 to 24 hours. Okay? Take your pain medication as needed. There's no medal, there's no big thing that said, I did this without pain medication. It doesn't work, okay? It doesn't happen. If you need it, it's there, take it, okay? If you don't need it, don't take it. There's no, again, you're not a better woman or a less better woman for taking them or not taking them. Okay? With a cesarean, you can usually hold and feed your baby once your recovery is finished. Once you're done, the doc's got you all sewed back up, you'll go into about an hour recovery in your room where we're going to monitor your bleeding, monitor your blood pressure, your heart rate, make sure that everything is stable. Much like a vaginal delivery where we have an hour recovery time, same thing with a C-section recovery time. We want to make sure that you are safe and that you are good to go. Breastfeeding is not affected with a cesarean delivery. You can feed the baby right after recovery. Okay. Your IV and Foley catheter that was draining your bladder are discontinued after 24 hours. And your vaginal bleeding discharge is usually less with a cesarean than it is with a vaginal delivery. Remember, don't lose sight of what you have accomplished. You've received the most beautiful gift, your baby. If you have any questions or comments, please be sure to let us know at our website. Thank you, and I hope you had a wonderful delivery with you and your new child.